I want to tell you about a man I will never forget. He was 67 years old, retired engineer, sharp mind, quiet dignity, the kind of man who spent his whole life solving problems without asking for help. He sat down in my clinic one afternoon, folded his hands on his lap, and after a long pause, he said, "Doctor, something changed." And I have not told anyone, not even my wife. What he described had been happening for nearly 8 months. He had noticed that during intimacy, the sensation was still there, the pleasure, the moment of climax, but the physical evidence he had always expected was simply gone. No fluid, or almost none. And in those 8 months, he had done what so many men do. He stayed silent. He pulled away from his wife slowly. He started avoiding intimacy altogether rather than face a conversation he did not know how to begin. By the time he sat across from me, he was not just dealing with a physical change. He was carrying shame, confusion, and a quiet grief that had been building for the better part of a year. And here is what I told him and what I want to tell you right now, before we go any further. What you are experiencing is not the end of your story. It is not a verdict on your masculinity. It is not your body failing you. It is your body sending you a message, and that message has a name, a cause, and in most cases, a very clear solution. You came to the right place today. I am Dr. Narita, a board-certified urologist with 12 years of experience sitting with men through exactly these kinds of conversations, the ones that are hard to start, the ones that feel too private to bring to a regular doctor's appointment, the ones that carry weight far beyond the physical symptom itself. Today we are going to talk about dry ejaculation, what it is, why it happens, what your body is actually telling you, and most importantly, what you can do about it. By the time this video ends, you will understand your body better than you did when you clicked play. And more than that, you will feel less alone with this. Before we go any further, drop a comment and tell me where you are watching from today. Men from every corner of the world are part of this community, and every single one of you belongs here. Hit that like button if you want more honest conversations like this one. And if you have not subscribed yet, do it now. Every week we talk about the things most doctors do not have time to say in a 15-minute appointment. Now let us get into it. First, let us understand what is actually happening. Before we talk about what goes wrong, I want to give you a clear picture of what is supposed to happen, because understanding the normal process makes the changes far less frightening. Think of your body's reproductive system as a perfectly coordinated team. Your testicles produce sperm, your seminal vesicles contribute the majority of the nourishing fluid that carries that sperm. Your prostate adds its own protective secretion. All of this is gathered, mixed, and prepared in the urethra, and at the moment of climax, a powerful rhythmic sequence of muscle contractions propels everything forward and out. It is a rapid, precisely timed event, the result of nerves, glands, and muscles all working in exact synchrony. Now here is something most men have never been told, and this single piece of information changes everything. Climax and ejaculation are not the same thing. Climax is a neurological event. It is the sensation of intense pleasure governed by your brain and your nervous system. Ejaculation is a mechanical event, the physical expulsion of fluid. For most of your life, these two things have happened together so seamlessly that they felt like one, but they are driven by entirely separate systems. This distinction matters because it means your capacity for pleasure, the sensation, the connection, the intimacy does not depend on the fluid. It never did. The pleasure lives in your nervous system. And in the vast majority of cases involving dry ejaculation, that system remains completely intact. What has changed is the delivery mechanism, and delivery mechanisms can be understood, investigated, and in most cases fixed. So let us talk about why this happens. Cause. Number one, the gatekeeper is not doing its job. This is the most common cause I see in my clinic, and it has a name: retrograde ejaculation. Here is the biology. Sitting at the base of your bladder is a small but critically important muscular valve. Think of it as a gatekeeper. Its job during climax is to clamp shut firmly and completely so that seminal fluid has only one direction to travel: forward, out. When that valve is too relaxed or not functioning correctly, the fluid follows the path of least resistance. Instead of moving forward, it flows backward into the bladder. You experience the full neurological sensation of climax. But because the fluid never exits, the result feels dry. Here is a practical clue that many men notice but never connect. After intimacy, your urine may appear slightly cloudy. That cloudiness is the seminal fluid that traveled into your bladder, mixing with your urine. It is not alarming, but it is your body telling you exactly what is happening. Now, what causes the gatekeeper to stop working properly? The most common reason is surgery. Procedures on the prostate or bladder procedures that are often necessary, often successful, often life-saving, can affect the delicate nerve network that controls that valve. The surgery does what it needs to do, but as a side effect, the valve no longer seals the way it once did. This is not a surgical failure. It is a known and manageable consequence. Certain medications can also cause this. Drugs used to treat high blood pressure and enlarged prostate alpha blockers specifically work by relaxing smooth muscle throughout the body. That relaxation is therapeutic for blood pressure and urinary flow, but it also affects that tiny valve. The medication is doing its job. The side effect is simply something that needs to be understood and addressed. Emotionally, I want to acknowledge something here. Many of the men I see who have this condition had successful surgeries. They healed well. Their health improved. And then this happened, and suddenly all the relief of recovery was replaced by a new worry. That emotional whiplash is real, and it deserves to be named. Understanding that retrograde ejaculation is a mechanical alteration, not a sign that something went wrong, not a reflection of your vitality, lifts a weight that is hard to describe until you have seen it happen in person, which I have. Many times. The practical solution here is genuinely encouraging. If a medication is causing the issue, adjusting or changing that medication under medical supervision can often restore normal ejaculation. If surgery was the cause, certain medications can help strengthen the valve's function. In cases where fertility is a concern, sperm can still be retrieved from the urine for assisted conception. There are real options here. Cause. Number 2, the pathway is blocked. The second cause is less common but equally important to understand, and it is one that men often miss because the signs can be subtle and slow-moving. Here's the biology. Your seminal vesicles and prostate are producing fluid normally. The production line is working. But the small ducts, the delivery pipes that carry that fluid toward the urethra, are partially or fully obstructed. When the pipes are blocked, the fluid has nowhere to go. Volume drops dramatically. Sometimes it disappears entirely, not because your body has stopped producing, but because the delivery system is compromised. What causes these blockages? The most common culprit is scarring from past infections. A prostate infection, prostatitis, that was severe or undertreated can leave behind scar tissue that narrows or closes these ducts over time. In some cases, small calcifications, essentially tiny stones, can form inside the ductal system and create an obstruction. How do you know if this might be what is happening to you? The signs can be subtle. Some men notice a very gradual reduction in fluid volume over months or even years, so slow that they barely register it until it is almost gone. Others notice a new mild discomfort or pressure in the pelvic area, specifically during climax. If either of those descriptions feels familiar, pay attention to that. The emotional reality of this cause is particular. Because it develops slowly, many men spend a long time wondering if they imagined it, wondering if it is just age, wondering if it is worth mentioning. By the time they sit across from me, they have often been carrying it silently for far too long. Here is what I want you to hear. A progressive reduction in ejaculate volume is a symptom. It is not aging, it is not normal, it is information, and it deserves to be investigated. The practical news is genuinely good. Many ductal obstructions respond well to treatment. Anti-inflammatory medications can address obstruction caused by ongoing inflammation. Where needed, minimally invasive procedures can clear the blockage and restore normal flow. This is not a permanent sentence. Cause number 3, the fuel supply is low. The third cause is one that connects dry ejaculation to a much broader picture of men's health, and it is one I want every man over 50 watching this to understand clearly. Testosterone. Most men know testosterone as the hormone of desire and muscle, but its role in the reproductive system goes far deeper than that. Testosterone is the primary fuel that keeps your entire male reproductive system functioning optimally, including the seminal vesicles and prostate that produce the bulk of your ejaculate volume. Here is the biology. When testosterone levels decline significantly, and they do decline naturally with age, though the rate and degree varies enormously from man to man, the entire production system slows down. The seminal vesicles produce less fluid. The prostate contributes less. The result is a measurable reduction in ejaculate volume that over time can progress to what feels like dry ejaculation. But here's what I want you to understand. Low testosterone does not just affect ejaculate volume, it affects the whole man. The emotional picture often includes fatigue that sleep does not fix, a flatness in mood that is hard to explain, reduced desire, erections that are less reliable, a general sense of being less than